Hi, good afternoon, everyone. This is Catherine Dunn with the Southern Education Foundation, and this is the Removing Non-Academic Barriers to Learning, Kentucky School-Based Family Resource and Youth Service Centers, otherwise known as Friskies. You'll hear us refer to these centers as Friskies throughout this webinar. This is hosted by the Southern Education Foundation, Coalition for Community Schools, and the Center for Popular Democracy. For those of you who are early birds, sorry for some technical difficulties with audio, but I think we should be all set for the next hour and a half. So again, I'm Catherine with the Southern Education Foundation, and we've got a pretty full agenda, so I'm going to get started. I'll start by giving an overview of our webinar content and then go over a few housekeeping items. So we're thrilled at the interest in the Frisky model in Kentucky, and we think that this comes at a critical time. The Southern Education Foundation released a report called A New Majority at the beginning of this year that found that low-income students in the country are now a majority of our students in public schools. This has actually been true in the South, and as you can see from the map on your screen, is especially concentrated in the 15-state South. It's been true that a majority of students in public schools are low income in public schools in the South since 2007, actually. And the southern state that we're discussing today, Kentucky, ranked 14th in our most recent report on low income students in public schools, with 55% of their students low income and 58% low income in rural communities. Low income in our report was defined by a student's eligibility for free or reduced priced lunch. Students are eligible for free meals at public schools if they live in households where the income is no more than 135% of the poverty threshold. They're eligible for reduced price lunches if their household is no more than 185%. So what this means is that a student in a household with a single parent with an annual income of less than $20,000 was eligible for a free lunch in 2013, or less than $28,000 for a reduced price meal in a public school. These students were a majority of our students last year. So what does this mean for public education? It means that the majority of our students face often significant non-academic barriers to learning. We know that if a student comes to school hungry or sick or worried about housing, immigration, unemployment, or violence, that they can't learn, at least not as well. We also know that the schools are often first responders to the issues that students face, and that when we use a community schools model that serves the whole child, some of these non-academic barriers to learning can be overcome. That's why we're talking about Kentucky today. In 1990, the Kentucky Education Reform Act sought to reduce inequities in the state's public education system using school-based centers that provide wraparound services to students and their families by connecting them to community resources, with the ultimate goal to help alleviate barriers to the educational success for all children so they can learn well. And they've seen increased student achievement in Kentucky, with Kentucky 4th and 8th graders continuing to outperform their peers nationally in reading and mathematics on the National Assessment of Educational Progress. So we think Kentucky serves as a model not just for southern states but across the nation, and we're so excited at the interest in this webinar and to share Kentucky expertise with you today. So we'll start off by hearing from Mary Kingston Roche at the Coalition for Community Schools, who's going to give an overview of the community schools framework nationally and how it aligns with the Kentucky Frisky model. We'll then hear from Bridget Blom-Ramsey, the Executive Director of the Pritchard Committee, and Cindy Heine, now retired from Pritchard, about the state policy and advocacy piece, how Kentucky achieved the Frisky model. We'll hear next from Doug Jones, who is a Regional Program Manager for Friskies in Kentucky, to hear about the implementation of this model from the state level, and then from Gabriel Brown, the coordinator of Youth Services Center at the Jesse Clark Middle School in Lexington, about how this model operates at the school level. Finally, Evie Frankel from the Center for Popular Democracy will describe some upcoming tools that can help you advocate for community schools in your states, and we'll conclude with questions and answers. So a couple of housekeeping things. Everyone is on mute until we get to questions and answers. If you have a burning question as we go along, feel free to type it in the questions box on the bottom right of your screen, and we'll try to address it when we get to the question and answer section. We'll also be recording the webinar and posting it to our website and sharing the link with all participants so that you can review it and also share with others who might have missed. So I'll start by passing it off to Mary to begin.
Great, thank you, Catherine, and welcome everyone. We're proud to be co-hosting this webinar with the Southern Education Foundation and the Center for Popular Democracy, and really excited to share what we think is a really promising strategy in Kentucky and both across the country through community schools. And this comes at a very historic moment, actually, for our country, as we just saw today the Senate pass what they're calling the Every Student Succeeds Act, which will replace No Child Left Behind as our nation's education law, and President Obama will be signing it into law tomorrow morning. And in this law, states and districts in their accountability systems will now be required to include a non-academic indicator for student success. So this is right in line with what we are sharing with you today, and states and districts will be really thinking about how to support students through these other indicators, and we think that Friskies and community schools are a great strategy for that. So we're happy to share this today with you. So I wanted to spend a few minutes just connecting for you how community schools relate to Friskies and a little bit more about community schools. And we hope that whatever your role is on the webinar today, whether you're a teacher, a community partner, an elected official, an advocate, that you check out our website to learn more and consider joining one of our many networks to stay involved with the community schools movement. So when we traveled to Kentucky a few months ago and Doug so graciously hosted us, we saw in Friskies community schools. We saw them as community schools. And you'll hear more from Doug and Gabriel about what makes Friskies so special. But I wanted to share a little bit about community schools, and you'll hear this, what I describe, resonate later with what they describe in Kentucky. So what is a community school? It's hard to boil it down to one definition, but we have a few points that help you understand it. So first, it's important to note that community school is both a place, an actual school, and a set of partnerships connecting school, family, and community. And a very important point is that it's not just another program that a school lobs on to other things, but it's an intentional strategy to weave together all these community assets that are sitting in the community towards student and family success. And what we know is that, as Catherine was describing, with the changing demographics and rising poverty, that schools can no longer do it alone. We need to rely on our community assets to come into the schools to support student success, both for supports for students and for enriching opportunities. And in fact, it's a waste of resources if we don't tap these community assets. And these can be anything from institutions of higher ed to local churches, to local businesses, community-based organizations, your local United Way or Boys and Girls Club. Another idea of community schools is that they become centers of the community and are open to everyone, including weekends and the summer. And this means that communities really feel that they own their schools and they take ownership in them. So in the before school, you might have a tutoring program going on with community partners tutoring students. During the school day, you might have community partners coming into classrooms to provide guest presentations or help with projects. After school, you might have kids traveling to a Boys and Girls Club or have programming at the school. And then in the evening, parents may come in to have a literacy class or have a potluck dinner. The school really belongs to everyone, and it functions 24/7. Community schools also offer a personalized curriculum to students. We want that students to feel that they also belong in their communities and that they have the power to help improve them. So community schools try to bring in the real-world issues taking place in their community through these partnerships so that students can work on real-world issues. And this is especially important for the higher academic standards that many states are incorporating. And finally, its integrated focus on all these things beyond academics, including but beyond academics, leads to not only greater academic success, but what we see is also stronger family and community engagement and also community development. So when you make the school the hub of the community and you invite everyone in to participate, we see stronger families and communities as well. We try to organize all this in a framework that is shown here. And in the middle, you see 3 buckets. Expanded learning is one of them, family and community engagement, and opportunities and supports. So in Cincinnati, Euler K-12 school has the nation's first in-school vision clinic, which diagnoses kids' vision and gives them free eyeglasses. And this is funded completely through a community partner at no cost to the school. That's an example of a support. And across all of these components is results-focused partnerships. So it's not just community partners saying we want to help out and coming in, it's really results-focused towards the school outcomes for students that community partners contribute to in a very intentional way. And just to share that the community schools movement is growing, and we know it's because school leaders are recognizing that they can't do it alone, and they're looking to their community partners. And so 8 years ago in 2007, we counted about 33 places operating systems of community schools, and now we count over 100. And so we hope that if your community is not in the mix yet, that it will be soon. And this is our logic model that you can find on our website, just to show you that all of these components that go into community schools, and when you look at the long-term results on the right-hand side, lead to not only stronger academic achievement, but students who are socially and emotionally competent, who are healthy, who live and learn in a safe, supportive, and stable environment, and where they live in communities that are desirable places to live because everyone's participating and taking ownership. So a few keys at the school site to highlight that Doug and Gabriel will share more in terms of Kentucky. You need to have a supportive principal who understands shared leadership and gives some of that leadership to different people. One of those people is the community school coordinator, and you're going to hear later from Gabriel, who's that coordinator for his Frisky in Kentucky. And they are really the person who organizes all these partnerships at the school and ensures that they're meeting students' needs and giving students enriching learning opportunities. And you see a few more components here that are critical, including a needs and asset assessment of the school and community and a strong results focus. These are a few of the outcomes that we've been tracking for community schools, and I just want to highlight the cost-effective strategy. It's great to share this with both sides of the aisle when we advocate that this is a great strategy for a return on investment. The amount of money you put in for a coordinator salary and the amount you get back through partnerships provides a real return on investment. And then the attention to broader results for students produces students who really are college, career, and civic ready, and not just proficient on tests. And just a little bit about the Coalition for Community Schools where I work. The Coalition is the home for the community schools movement, and we're based in DC. We have an alliance of over 200 national, state, and local partners, and Catherine and Evie's organizations are 2 of those. And we try to bring together people from education, youth development, health, government, and philanthropy around this vision of community schools. This is a picture of a few of our partners, and you can see that they range from major national education organizations to institutions of higher ed to relevant campaigns that advance this vision. This is our vision and mission for the Coalition, and I hope you find that this resonates in what we talk about today, where we see schools as centers of flourishing communities, where everyone feels that they have a place and works together for young people's success. At the Coalition, we do a few key things, and we encourage you to check these out on our website, and especially for the networks to get connected. We have networks for state leaders, for community school coordinators, and for other roles. We have many resources on our website that we also encourage you to check out, including from how to start a community school to case studies on what this actually looks like at a school. And finally, we hope you will all join us at our national forum coming up in April. Registration is now open, and it's a great chance to see this live in action and to hear from other people around the country doing this work. So please join us then, and thank you very much.
Thanks so much, Mary. It's so exciting to see the community schools movement and how much it's grown thanks to the coalition's leadership, and exciting to think about Kentucky as one of the models in this movement, especially since it's happened at the state level. So we'll turn next to Bridget and to Cindy to hear a little bit about the background of how they were able to achieve this, this state policy win.
Great, thank you, Catherine. Okay, we're having trouble finding the advance button, but we're working on that, so I'll go ahead and get started. So as Catherine mentioned, my name is Bridget Ramsey, and I'm with the Pritchard Committee for Academic Excellence. And with me is Cindy Heine, who spent well over 20 years with the Pritchard Committee, beginning in its early years, and has tracked this work over that period of time. So as Catherine and Mary both mentioned, Kentucky's Family Resource and Youth Services Centers, we fondly refer to as Friskies here in the state. They were enacted as part of Kentucky's Education Reform Act of 1990, which was a comprehensive education reform package that resulted from a Kentucky Supreme Court ruling on an equity lawsuit. Prior to 1990, groundwork had been laid by the Pritchard Committee and other partners that advocated for including something like the Frisky Model in the school reform legislation. And the purpose was to address the social-emotional needs of children and families. They included the need to engage parents and the community, since schools could not do this alone. There were specific reports that the Pritchard Committee worked on that laid out some of these guiding principles and strategies. None of the reports specifically recommended Friskies by name, but they all called for addressing the condition of children and youth and their social-emotional needs. So the first of those was in 1985. The Pritchard Committee issued a report with recommendations on elementary secondary education. It was called The Path to a Larger Life. It included a chapter on a new commitment to children and youth, highlighting the many social, economic challenges facing Kentucky students and their families. It recommended preschool and daycare, teen pregnancy prevention and services to teen parents, prenatal care, community involvement in addressing these needs, engaging parents with schools as community centers. It called for a requirement for community service for high school students and more counselors to support high school students. All of these things were intended to help students be better prepared to learn and to increase student outcomes. Shortly thereafter, in 1988, the Interim Joint Education Committee of the Legislature issued a paper on educational improvement, The Next Steps. Its goal was that by the year 2000, all children, underscored, will be ready to enter the first grade with recommendations for a well-child program with comprehensive screening for more low-income children and for model preschool programs. Then in 1989, a coalition of school advocates, including teachers, school board members, administrators, PTA, the State Chamber of Commerce, all issued a report entitled Improving Kentucky Education. This report called for addressing the mental, physical, and emotional health of all children leading up to kindergarten entry, along with the need for preschool, child care, and prevention services and services for teen parents. So all of these, I'll let you go ahead and click. All of these reports then helped lay the groundwork for key components included in the 1990 Education Reform Act in Kentucky. All of this was going on while the lawsuit was making its way through the courts between the years 1985 and 89. The Supreme Court ruling in 1989 and then the resulting legislation, the Kentucky Education Reform Act of 1990, emphasized all students, each and every child, quote unquote. Because Kentucky is such a poor state, no one disagreed that we needed to provide supports for our children and families in poverty if we were to help all students reach success. The legislature took the court ruling seriously and organized a task force to address its requirements. And they wisely hired David Hornback as a consultant for this work. He recommended the development of centers to address students' social emotional needs that interfered with learning. He suggested that teachers had been meeting these needs for years and that having someone else responsible for meeting these needs would allow teachers to focus on instruction and more effectively and comprehensively meet the needs of the children. His recommendations, patterned after successful models in Connecticut and New Jersey, were met with approval from the education advocates and legislators and were adopted as part of the 1990 law. The only pushback at the time came from a few then disorganized pro-life advocates who worried that the youth service centers in our high schools would refer students to family planning and abortion services. The result was the recommendation to include teenage pregnancy prevention services being dropped from the list of suggested services to youth. The legislation required the following. At the high school level, go ahead.
Need to go back. I want to do the. Oops. Sorry.
All right, so I'll keep going as we're getting to the right slide. And we wanted to note that the law said centers were to provide, but not be limited to, the services that we'll show on the slides. The centers were to address the unique needs of students and families in each school. There were specific criteria laid out for elementary and middle schools, and then other criteria for high school students. And you see those on your slide now. So some of the pieces for elementary and middle schools were a requirement that the Family Resource Youth Service Centers help connect the dots for families to full-time preschool child care for 2- and 3-year-olds, after-school care, families in training, which included home visits, group meetings, and monitoring child development for new and expected parents, the PACE program for parents and children learning together, support and training for child care providers, and health services and/or referral to health services. So the Friskies were to be the bridge between the school system and the community services there to help parents and students. At the high school level, specific pieces called for referrals to health and social services, employment counseling, training and placement, summer and part-time job development for youth, drug and alcohol abuse counseling, and family crisis and mental health counseling. And again, the Friskies were not actually providing the services, but they were connecting students and their families to the services already present in the community. The new law to implement the Family Resource Youth Service Centers, the new law called for an interagency task force of state-level stakeholders to develop a 5-year implementation plan for the centers, and required participation of a broad range of agencies, from educators to social, health, mental health, and employment services to the Justice Cabinet, parents, and school board members. The law created a grant program that provided funds for schools with enrollment of 20% or more eligible for free school lunch. Funds were allocated to the Department of Education from the legislature, but the department passed that money on to the Cabinet for Health and Family Services to administer the dollars through the school districts. So no more than $90,000 was given to a school, and it was on a per pupil calculation. The lowest amount provided to a school was at $10,800. The highest was $90,000, and the average provided to a school was $68,100. In the first year that the Friskies were implemented, $9.5 million was budgeted in the state budget for initial implementation, and then in 1994, $26.4 million was allocated for full implementation. This funded 373 centers across the state of Kentucky and 638 schools. Funds were provided basically for a director and a phone. They were not intended to purchase services, but to coordinate with existing resources and services. This was important, recognizing that there were resources and services already available in communities, and that the Friskies would provide the coordination and networking to see that children and families received the services they needed. So since 1990, our Friskies have been continuing that work and have received great support from our legislature, and there's no sign of that wavering. So Catherine, with that, I'll turn it back over to you for the next speaker.
Great, thank you so much, Bridget. We did have Brian Akers, who was, you'll see his name pop up, who is actually sick and unable to join us today. I think the important thing to note from what Brian would have talked about is that the important advocacy work that Pritchard did to get CARA enacted and to get these Friskies as such an important component of that reform is that this advocacy work is ongoing. The model, you know, continues to be improved upon, and that important work is happening to continue to advocate for Friskies. We'll now pass to Doug Jones, who's the Regional Program Manager for Friskies in Kentucky, and hear a little bit about the implementation of this model from the state level. I'll pass it on to you now, Doug. Thanks.
They were able to come down and do the visit, and we did a 2-day tour, and we're actually doing filming tomorrow and Friday with some sites, so that might be something that will be of interest to those of you as well in the future. I was actually in the legislature the day that the Supreme Court ruled and upheld the lower court's decision. As a business person, and having been involved in Pritchard Committee for many years as a member from the community, little did I know that I would end up being a local coordinator and doing that for about 5 years before I took the position as a regional manager. I also wear a hat with public policy with the coalition that Brian was going to speak about. Our executive director is on, I think, Melissa Goins, and maybe at the end, if you have any questions, be glad to have her jump in on that as well. The General Assembly really was trying to provide for an efficient system of common schools, as Bridget and Cindy were talking about. I'll tell you just a little bit of history as far as implementation and how that all happened even prior to 1989. Beginning in about 1986, Governor Wilkinson, who was here at that time, put together a committee saying we're going to have to do something about our problems in Kentucky. And so as a result, they formed a committee, and it was called the KIDS, K-I-D-S, Interagency Delivering System. So that was KIDS acronym. And it brought to the table from across the state and all agencies, such as social services, mental health, Kentucky Department for Education, the Cabinet for Health, Cabinet for Human Services at that time was separate, vocational rehabilitation, and then parents and advocates from across the state. And they formed an outline for service and what they would like to see happen, because it was the first time that all of the different cabinets and that actually government, schools, business, and industry were brought to the table to actually come up with some engagement and to form a plan. And during that, they were looking at finance, they were looking at governance, and they were looking at programs. And that's kind of how Dr. David Hornback got involved. And as a result, this interagency approach developed a 5-year plan. And in 1987, 88, and then made the recommendation prior to the 1990 session that passed the sweeping reform. So the time frame really was not feasible in that statute was awarded later through the legislature. But I'm having trouble, Mary, I cannot access, there we go. All right, great, thank you. So obviously I won't reiterate what they did such a great job from Pritchard explaining, but that we had the sweeping reform, and as a result, you can see the 10 areas there that were original parts and components of the Kentucky Education Reform Act of 1990. Within that period, we still deal with technology, not as much as what we would like. As far as one time, Kentucky was the leader for technology in the schools, but as a result, as you know, funding and unfunded mandates and making Family Resource Youth Service Centers a priority has kind of weakened some of the other areas as far as appropriations. But those 10 areas were critical for the sweeping reform that we had in Kentucky. The Family Resource Centers, we'll move on to the next one, but I'm again having trouble. Thank you. The philosophical premise was that there's 3 underlying themes to the philosophy of the program, and that was and continues to be paramount to everything we do. Increased parental involvement, brokering for services for students and families, and broader community development. I'll have to tell you that also there were no models for Family Resource and Youth Service Centers. And of course, it was brilliant out of Dr. Hornbeck and the group from kids, and then they started the interagency task force. But they modeled the Family Resource Centers, and if any of you are here from Connecticut or New Jersey, Dr. Ed Ziegler, who was, I think he's since passed, but he was a Yale professor, and he began the 21st century schools there at the Bush Institute. And so the Family Resource Center components were predicated on that model. And then the youth service centers, which serve middle schools and high schools, were based on a model that actually came from the New Jersey Department of Families and Children, and that was called, I'm not sure if they're still running, but they were called the School-Based Youth Services Center programs. And we can move on if I can't control that. The group wanted to implement, according to this interagency task force outline, and they developed a system of school-based interagency services. And it's the first time really, as we said before, that they cross-reference, and actually all of the localized efforts are based upon that model. All Family Resource and Youth Service Centers operate under an advisory council, which brings together a minimum of 1/3 parents, preferably the parents chairing the advisory council, and within that framework, there are people from representations across the boards from, as we said before, government, schools, business, industry, chambers of commerce. And as a result, these partnerships among all the different entities, you know, have been the key to our community development and the underlying themes. So they created also an atmosphere of empowerment. That's very important to what we do. The mission is to enhance students' abilities to succeed in school by developing and sustaining partnerships that promote early learning and successful transition into school. So obviously, in the early years in Kentucky, we had virtually very few quality child care centers. As a result, our centers where there was a need, and all programming is based upon local needs assessments, and they design the programs based upon that. So with that being said, many of our centers at that time began child care centers on site. Over the years, those have increased as opportunities and employment opportunities for their different communities, have opened up their own private businesses. So many of the centers provided the seed and were the catalyst for it, but then we never want to duplicate programming or other resources. So as a result, they have been able to provide that seed, and then they're taken over by someone else, as they do with other programs. And then once they transition into school, now we're also very involved with a great research-based program, which is called the Born Learning Academies. I'm not sure if any of you are aware with that, but certainly those of you that would be participating from the Northern Kentucky, Cincinnati area, those were founded in that area. And we have those funded through Toyota, United Way, and also a Race to the Top grant, which comes to the Division of Family Resource Youth Service Centers. So we are making great strides in early childhood learning, and once they enter school, you know, that philosophy to some of the principals at that point were, why are my centers going out to do programming with children that are not in school? And of course, over the years, they've gotten the message that by the time they get to school, you know, we're often putting a Band-Aid on them, and it's a little bit too late. So as a result, our early learning approach has really changed the way we do business with the Family Resource Centers. So once that happens, and then we concentrate on the health services and all those components that Bridget already spoke about, I won't go into those again. We aim for academic achievement. So we get academic achievement in a lot of ways. We say that all children can learn and all children can learn well. However, if they do not have electricity in their home, it's been cut off. If they do not have food or utilities, or they do not have adequate school supplies, clothing, our centers do not pay for that, but they have an optional component, both in Family Resource Centers and Youth Service Centers, which is called educational support. And as a result, they raise money from a variety of resources and establishing those partnerships that they're able to do that through their coordination of services that they do. So our aim is that by concentrating on the non-cognitive factors, then they're going to receive academic achievement and well-being while they're actually in school. And then finally, our goal is, with the youth service centers and the high schools, is that all will be college and career ready, and they do a variety of things that maybe Gabe will speak about, which allows for successful transition into their adult lives. So they also are the ones who provide the community development. In the early years, when we first went in, and I was one of the first centers at a local level, we would go out to the community, and if we would go to the mental health agency or social services or whomever, and we get every resource in our small rural community, and they would say, wow, this is the first time anyone from the schools has ever been here. And as a result, they served on advisory councils, interagency councils, and the centers have also been the catalyst for establishing in their local communities interagency groups, which meet regularly, and they talk about issues and funding and ways that they can collaborate, which is our key word, to try to alleviate any barriers to the child's academic success. In my area of Appalachia alone, there is a child welfare agency that all of our centers participate in, and there are 67 in my region. And they have brought into this region alone $14 million, which goes for basic needs for children. So nothing comes out of the grants anymore for that. Basically, their grants, which are done on a 2-year basis, fund for the salaries for the staff. As Bridget said before, the money flows from the free lunch numbers of December 1st, and based on that, It flows from the Kentucky Department for Education and the Cabinet for Human Services. A contract has been given from the Cabinet for Health and Human Services, which goes to the local school districts. And that is what we as regional program managers, you can see the regional map there. That is how the funding goes, and then we maintain the contract to make sure that they're in compliance with what the district has assured that they will do in carrying out the services and the plans for the centers. The structure was put in place to increase the collaboration and communication, of course, at all levels. And over the years, as Bridget was saying, the first appropriations, I think there were 111 centers the first year, which was 1991. And then we now have 813 centers across the state, and we still are not fully funded. It took a little longer than what we expected. There was an interagency task force which was formed that worked for the first 5 years, and that kind of helped with the implementation. Training was developed out of that. Our centers went to, for the first 5 years, to the National Center for Community Education in Flint, Michigan, and that's how pretty much the philosophy was developed, and coordinators were engaged and learned the way that they would address all of these principles. So family support, which you see, working together in relationships. Out of that also came the idea for developing the coalition, which Brian was going to speak about. But I will tell you that we did a survey. We do it every biennium because our money is funded every 2 years based upon those numbers. And once they're in the school, we work with all students regardless of income, but that is the basis for the budget. But the coalition was a brilliant idea. That was an outgrowth of the National Center for Community Education in Flint. And as a result, they advocate and educate, but do not lobby. And then as a result, we have several different activities, which sometimes we can talk about, but we have students that compete to be able to be legislative pages. We're always advocating in a variety of ways. And the factor I think there is that legislators are very active in these programs. Some even have them on their advisory councils, but they're in the districts, they're in the schools, and they're in the centers on a regular basis. And tomorrow alone, we have, as part of our filming from the NEA, the leader of the Kentucky legislature for the House majority that will be part of the interviewing, and then we have from the Senate the minority leader. So the support that is garnered from the coalition, and particularly from the center coordinators, is key to the fact that for 25 years we've had the sustainability of the Family Resource Use Service Centers. When all state agencies were cut and spending was reduced, the Friskies were saved every time except for one, and all state government had to be reduced. And during the last session, very unexpectedly, due to legislative support, over $1 million was given in addition when no other state agencies were receiving any additional support. So that's something that tells the story and why they're viable. We abide under the principles of family support, strengthening families. And if you look at the future, you know, we do say that part of our mission and certainly our vision is whatever it takes, and that, you know, we will remain committed to our mission, and we do say that we are constantly striving to be the national standard for the provision of school-based social services and services. We even have health clinics in some of the schools. We have mental health counseling that's brought in. We have dental clinics because that's a huge issue in Kentucky. Child care on site in some. But again, I would just say that, you know, we remain committed to the quality But the beautiful thing about what the centers do is that all of them have mandates and components that they have to address. It's the flexibility-based programming on the needs of the local community, the local school, and that is what makes them work and why we have the quality as well as the quantitative data to back that up. So I think that gets me. Thank you very much.
Thanks so much, Doug. That was awesome. And as Doug mentioned, a couple of us were able to go see some of these Friskies in action a month or so ago in Kentucky and see the critical role that coordinators at the school level like Gabriel play. And while I regret that all of you on this webinar can't see it in person, I'm excited that Gabriel is going to walk us through a little bit about what this looks like at the school level. So I'll hand it over to Gabriel now.
Thanks, Catherine. I appreciate that. Looks like, let's see, taking control now. I want to thank you guys for having me on here and just hearing a lot of wonderful things about community schools and how that really does align with what we do here in Kentucky. I am a coordinator at a school of about 950 children. We have about a 36% free lunch rate based on our December 1 numbers from this year. This is a quick presentation, kind of an overview of the role of family resource centers in schools, looking at development, engagement, and programming. Currently, we have, as Doug said, 813 centers representing 1,181 schools, which serve over 626,000 Kentucky students. It's incredibly important that each center takes both a student and school-specific approach to all of its efforts. What works in one school may not work in another. The best example of this is kind of how Kentucky is. You know, we have rural communities, we have urban centers. What works in one doesn't necessarily work in the other. In the rural settings, the center may be one of the main resources in the area, whereas in the urban setting, there could be a host of community resources, business partnerships, faith-based supports, and things like that. So it's very important to keep that individualized approach in mind. When looking at the development of each Frisky Center, it's important to take a structured and kind of a measured approach to development. It may not need to specifically follow this model, but it does need to be intentional and based on the needs of the school, the student, the family, the community population that it's designed to serve. Even though our approaches are individualized, our grant components, which are shown here at the top, and I think that a couple of people have touched on those are consistent across the state. You can see family resource centers, which represent the elementary school at the top, the youth service centers, which represent middle and high schools there in the middle, and you can see the mandated components for each of those centers. The family resource centers really have a focus more on families, the youth, definitely a little bit more of a focus on youth. Schools can choose to develop optional components to address other areas of need, but these are the ones across the board. At the bottom, you can see that we develop this programming within each of these components by doing assessments with the different populations that we collaborate and serve, and the main ones are the students, the families, the schools, the teachers themselves, and then looking at the community. As Doug said, you know, this is the advisory council as the group which offers guidance and input to the coordinator and the center. It serves as a sounding board, a volunteer base, a system of checks and balances for all of the center efforts. The composition of the council, which changes periodically, includes at least 1/3 parents, no more than 1/3 school staff, and the remaining third is made up of members of the community, and in the case of youth service centers, 2 students, which gives and assures a student voice in what we do. The council meets every other month, including over the summer months, to help with consistency in programming. I can also add that it's incredibly helpful to have a council which accurately reflects the population within the school. This slide on school integration just illustrates some of the key players involved in making a center effective in serving its students. Frisky collaboration and coordination allows each population to bring a different and integral support to the student population, which is the focus. Each school can identify students in need of a different mix of individualized supports. These supports can be facilitated in different settings by different providers, but they all have the best interest of the student and the removal of a specific barrier in mind. Student engagement is the bulk of what we do on a day-to-day basis at the school, building relationships with students to better understand their individual and collective needs. There are so many ways to implement this with student engagement, but the simplest measures seem to be like the most effective, just being present, available, accessible, and genuine with the students that you work with. The list on the bottom could really go on and on. These are all different types of services, but these are some of the more common ones that you see across the board. Each one of these can be handled through individual supports, targeted programs to specific subpopulations, grade levels, or even to the entire school. And like Doug said, we do work with the entire school, even though our funding is based on our percentage of free lunch students. Family and community involvement is also a key piece to what Friskies do throughout the year. You can see some of the parent supports that we focus on in white, which are achieved through making family referrals to community providers or even bringing community programs and services into the school. Additionally, you can also see here 6 protective factors in yellow. These represent the Kentucky Strengthening Families framework. The goal of this measure is to design programming and services with the intent of increasing these specific protective factors among our families. This is an example of, actually it's an oversimplified example of Frisky programming in schools. And you can see basically you're identifying a need or a gap, which you see in yellow, then implementing a program, which you see in white, along with the important partners and stakeholders, which you can see in green. The first one addresses an academic and behavioral need in the school and looks at building an effective transition program for the incoming students. And you can, again, see all of the people that are involved in that program. The second one tries to meet the basic needs of students and families by increasing access to food by placing resources in a more accessible location. And you can, again, see that there's the Frisky involvement, community involvement through multiple partners. And then the bottom one looks at student emotional and behavioral needs, both with regard to an increase in need and a decrease in accessibility. This is one that we've just gotten grant funding for through Project Aware, and I just want to point out that all of these programs are in place in multiple schools across our district. And finally, this is the last slide, and this just kind of looks at what we've been able to accomplish in Lexington over a 3-year period. I know the panelists that came to Lexington and saw this were given this when they came. You can see some quick demographics at the top, the number of students, our percentage of free and reduced lunch numbers, which is, right on par with the state average. You can see some services by setting and type in the middle, before school, during school, after school, and then again during the summer because we do programming year-round. And then you can also see some of the specific services that we do and the volume of some of those services and the percentage of change that we've had to adapt to kind of meet the rising need for this. I want to thank you guys for having me, and if anybody needs any more information, feel free to give me a call or contact me. Thanks.
Thanks so much, Gabriel. Now that we are all Frisky cheerleaders, I'll turn to Evie Frankel to talk about some of the tools that she's working on with some of CPD's partners to help folks advocate for community schools in their communities and in their states.
Do multi-issue community organizing. Take control. I don't need to take control because I was smart enough not to have any slides, so I wouldn't have to figure out how to take control of them. And when Mary was talking earlier about community schools, she was saying that organizing groups are now diving into the work that practitioners have been doing on the ground for so long. We've got about 5,000 community schools in the country at this point, and as organizers looking for solutions to the problems that face public schools in communities all over the country, we feel like kinder, gentler Christopher Columbuses who discovered pay dirt, and community schools really seem like a huge piece of the solution to problems that face public education. They have amazing results. The folks in Kentucky were really modest in talking about their schools. They gave you a lot of information. What they didn't tell you is that in the 25 years that they've been Family Resource and Youth Service Centers, they went from 45th in the country to 10th, according to Education Week's annual quality counts reports of key education indicators. Harvard University student improvement data calls them 8th in improvement over 2 decades. They have the 9th highest national high school graduation rate, the 13th lowest high school dropout rate. So this, and they only have a 1.4% achievement gap, which is fairly remarkable, opportunity gap, my bad, which is fairly remarkable. So as you can see, this stuff really works. And what is the most exciting to us as organizers about Kentucky is that it works on scale. This is a program, a lot of folks who are familiar with the community schools work that's been going on around the country is that in many places it goes school by school. I'm lucky enough to be working in Baltimore with our organizing groups where we have about 50 community schools. And in doing that work in Baltimore, I've been lucky enough to come into contact with Dr. David Hornbeck, who's been talked about so much here and is now living in Baltimore and helping us out. And it was through him that the folks doing the work in Baltimore became familiar with the Kentucky model. What's the most exciting, I think, for folks to know about this model at this moment is that we believe it to be entirely replicable. The Center for Popular Democracy has been working for the last 3 years at a national table with both teachers' unions, several other community organizing networks, and several research and policy shops at the national level. And that group altogether is called the Alliance to Reclaim Our Schools. And as an organization, we've taken it on as a mission to popularize the concept of and to expand the presence of community schools nationally. And we've been using a policy model in addition to an on-the-ground organizing model to do that work. And so in the 2015 legislative session, we developed a policy template that encouraged states to create grants-based programs that would fund community schools in their states. That bill was introduced in 8 states, versions of that bill, because what we offered was a template, and so folks adapted it to the needs of their own states. That template was introduced, a version of it in about 8 states. It was passed in 3 states. One of them includes Minnesota, where they're now rolling out community schools. Maine passed another version that actually CPD did not have anything to do with it, and Ohio passed one that was then sort of taken over by privatizers, but remains as a real option for school systems and schools in Ohio who want to become community schools. This year, and about to be introduced in the 2016 legislative session and available for viewing by all of you on this call, will be another template that will be based on the Kentucky model. And so the idea being that at this point we don't have to look to fund community schools individually. We can look to the state to incorporate the concept of community schools into the funding formula of the state. And, you know, again, as I said, lucky enough to be working with Dr. David Hornbeck, he's figured out a formula that sets aside a certain amount of money within the per pupil funding formula for a site coordinator, for health services, for after-school services. And as I said, that model template will be available for all of you to take a look at and to try to roll out in your states. In January, it'll come to you along with the earlier grants-based template embedded into a report about what we're calling transformational full-service community schools that adhere to 6 key pillars of community schools developed by the Alliance to Reclaim Our Schools. So I don't want to go on any further. I think I'll hand it back over to Catherine and let us all take questions because I know it's at the end of everyone's workday. Thanks very much.
Thanks so much, Evie, and to all of you panelists and to all of our attendees for your interest in this. And we've got a couple of questions already posed. I want to call folks' attention to the Q&A box on the right of your screen. There's a hand right above the Q&A. If you click that, it's like raising your hand, and we can unmute you to ask your question verbally. While folks do that, I'll go ahead and direct some of the questions in the Q&A box. Doug Wood says, in Michigan, we have FRCs, Family Resource Centers, I think, operated by the Department of Health and Human Services. As such, those families with open caseloads are the primary target of the services. The school certainly benefits, but not all students. Are your FRCs able to serve all? Doug, that might be a question for you. Are you able to address that?
Yes. All students are served under the Family Resource Youth Service Centers in Kentucky. It makes no difference about, you know, income or, but I will tell you that there are a lot of efforts. Most of our center coordinators are involved with the leadership teams at their schools. And we also have programs where social services actually come in and meet on site at the schools with the center coordinators, the therapists, and the caseworkers from social services, particularly on those high involvement students. So there's a great deal of, you know, communication with them, and many of the social services, well, almost all have, the centers have advisory council members from social services. But yes, they work with all students in the schools.
Yeah, that's absolutely correct. If I can jump in, and it's really a wraparound approach to everything. And so we are working with all the stakeholders, we're working with all the schools. We wanted to make sure that we included everybody else and not just one population, because there's lots of kids that fall through the cracks for different reasons, and we didn't want to focus on especially students that are getting services from a provider already, because there's a lot of our students that don't receive any services and really need more than we can provide.
Yeah, and I would say that some of our students also that come from even the highest socioeconomic backgrounds are in need of a variety of services and are served, particularly with mental health counseling on site.
Thanks, Doug and Gabriel. And this next question might actually be for you all, or Bridget. These centers are great resources for rural schools. In lower resourced rural communities, what are some creative ways that directors obtain services? And are there different requirements for schools based on their community resources?
Well, I would say, particularly because I work a lot with rural sites, there aren't any, you know, they're the catalyst, as I said, for bringing everyone to the table. So sometimes when you have the least amount of resources, that's when you're the most creative. And just because of the buy-in and the engagement and the ties that they have, you know, that is a non-issue. Our rural centers address them in many different ways because they don't have the resources. But if they don't have them, they create them. One thing I will share with you all too that I think I didn't mention earlier, but we do a survey each session, and during the last one, it lasted a little less than a week, and all the center coordinators sent it out. This is done through the coalition, but we had over 16,000 responses in less than a week, and over 6,700 teachers responded, and around 5,000 community service providers. As a result, none of the components of that were less than 90% favorability, and most of them were high, in the highest level of support for the centers for sustainability and continued funding. So that's pretty remarkable. That's across all levels, of course.
This is Mary with the Coalition for Community Schools. I just wanted to weigh in on this question as well. I think it's also important, we emphasize for all schools acting as community schools to make sure that they not only do a comprehensive needs assessment, but an asset assessment as well to look at your community assets. And sometimes in more rural communities, they might not be as big as in urban communities. You might not have a big United Way down the street or a Boys and Girls Club, but if you look at people as assets, individuals, and different community partners, you will find some things that you can bring into schools. So we've heard about local artists who volunteer their time to run after-school programs for kids in rural areas, and in our trip to Kentucky, we heard some great examples in terms of using the local booster club to pay for high school kids to coach a summer basketball camp, having kids use the school kitchen to do a culinary arts program in the summer. And so it's really just thinking creatively about your resources and making sure you pay attention to the assets, even if they're not as immediately visible. And when you engage the family and community in the way that we promote through community schools and Friskies to bring people in, you'll often find assets among these individuals that you might not have noticed before. And so it's really starting with bringing people in and asking them what might they want to contribute, and that can get you to some resources that may not have been visible. And then the other point would be, I think this is the importance of state leadership on this work, or the opportunity for that, is if you incorporate this into state funding, the state can then direct proportional resources to under-resourced communities, including rural communities, to supplement what they already have. And that does happen through federal policy, but the states certainly can help direct more resources to more under-resourced communities.
That's great. I have a good example of something that happened in our rural areas, is that most of them were not involved in any way with Salvation Army. Those were always in the larger urban areas in this particular part of the state. As a result, the center served as catalysts for trying to get Salvation Armies in, and as a result, they coordinate all the bell ringing through their volunteers, their advisory councils, and as a result, Salvation Army throws all the money towards their centers for specific basic needs through the year. So that's another example of how they're very creative in trying to overcome those barriers of rural communities.
Our next question might be a good one for Bridget and Cindy, asking about whether there's there was a collaborative body that helped move this effort along.
Yes, this is Cindy Heine. Yes, there was. The statute in 1990 called for an interagency task force, and the statute was very specific in laying out who should be engaged in that task force. And they were tasked with developing the program from the start. It was set to sunset in 5 years. They didn't really want to create another level of bureaucracy, I think. But they did put together a task force that set all the parameters and helped make a lot of the decisions, think about training needs, and put the grants together in those early years. Doug, you might want to talk a little bit about the current collaborative effort.
Yeah, thanks. Yeah, that was perfect. And as a result, after that sunset, most of the policies, procedures, and everything are done through the staff in Frankfurt and, you know, with the regional managers coming together. So a lot of that, in addition to, there's a training council, which is made up of coordinators. There are many different groups that they're involved with in training, where coordinators are appointed and serve on councils. All of their Fall Institute and Victory Over Violence trainings are done that way. And then certainly the collaboration with the Family Resource Youth Service Center Coalition, which does a wide variety of collaborations for that as well.
Great, thanks Cindy and Doug. Mary, this next question might be a good one for you. It asks, what are the provisions in the new ESSA for community schools?
Sure. Thanks for the question. Since I've been living and breathing this for a while, and happy to share that it's finally happening. So we're excited to report that this new bill, which will be signed into law tomorrow, seems to be very supportive of this type of work that you see in Kentucky with Friskies and community schools overall. It actually includes a full-service community schools program in the bill, which will give 10 grants annually to communities to implement community schools that local districts and community partners can apply to. But I think the more important thing that I mentioned earlier is that it departs from No Child Left Behind, which only focused on test scores, and requires states and districts to incorporate into their accountability plans a non-academic indicator. And a state and district can choose what that is, but a few examples could be chronic absence or school climate, including safety and school discipline. It could be teacher engagement, student engagement. So these are indicators that we know really matter to student success that we address through Friskies in community schools, and that will now be required for states and districts to track and to report. So this is very exciting because we think that this opens the door for a broader, more whole child approach to education that we are all advocating for. And I think the task now is to work with our state chiefs, our state boards of ed, and all of our state legislators to develop policies and strategies that really lift up community schools and lift up this strategy with this new opportunity. So I think for us, it's very exciting, and it just means that with the power going back to the states, it's going to mean a lot more work at the state level to really make this a reality.
Great, thanks, Mary. Thanks everyone for these great questions and for your time today. I'll make sure when we distribute the link to the recording and to the PowerPoint that you have all of our panelists' contact information so that you can go to them with any other questions that you might not have gotten answered today or anything else that comes up. I know it was a lot of information after today. I want to direct folks now, as we wrap up, to a webinar that SCF is hosting next week on the 15th at 2 with the Z. Smith Reynolds Foundation on some polling that they've done on how North Carolina voters view public education and tools for communicating the value of public education. You can find the link to register to that on southern-education-network.org under events. This is our website, which provides an online forum for advocates and organizers to be in touch with each other throughout the South. I want to thank everyone for joining us today, and especially our hosts, the Center for Popular Democracy and the Coalition for Community Schools, and our wonderful panel from Kentucky for sharing your expertise and describing all of the hard work that's gone into the Frisky model and continues to in an hour's time is no easy task, I know. So thank you for sharing with us, and we'll continue to be in touch. Thanks, everyone.
Thank you.
Mm-hmm.